Welcome to this video on historic developments in epidemiology, based on Chapter 2 of Introduction to Epidemiology by Merrill. In this lesson, we'll explore the stories and discoveries of major figures in the history of epidemiology. From Hippocrates to John Snow, each individual helped shape what we now call modern public health. Let's dive into the timeline of how observation, data, and science came together to transform how we understand disease. From Hippocrates to John Graunt. We begin with Hippocrates, who lived in ancient Greece around 400 BC. Often called the father of medicine, Hippocrates rejected supernatural explanations for disease. Instead, he emphasized the role of environment, diet, and living conditions. Fast forward to the 1600s, John Graunt used mortality records in London to systematically record deaths by age, cause, and time. He created the first life tables and helped distinguish between acute and chronic causes of death, foundational for modern vital statistics. Sydenham, Ramazzini, Lind. In the 1600s, Thomas Sydenham emphasized careful observation of patients and patterns of disease, rather than relying on theory. He advocated for practical treatments and healthier living environments. Bernardino Ramazzini, in the late 1600s and early 1700s, is known as the father of occupational medicine. He studied how workplace exposures like toxic chemicals and repetitive motion caused illness in workers. Then there's James Lind, who in 1747 conducted what is considered one of the first clinical trials. He proved that citrus fruits could cure scurvy in sailors, a breakthrough in nutritional epidemiology. Vaccination and smallpox. In the 1700s, Benjamin Jesty, a farmer, noticed milkmaids who had cowpox didn't get smallpox. He tested this by exposing his wife and children to cowpox to protect them. Edward Jenner, a few decades later, formalized this observation. In 1796, he inoculated a young boy with material from a cowpox lesion. The boy became immune to smallpox. Jenner's innovation laid the groundwork for modern vaccination and disease prevention on a global scale. Semmelweis and infection control. In the 1840s, Ignaz Semmelweis worked in a maternity hospital where many mothers died from childbed fever. He observed that doctors often moved from performing autopsies to delivering babies without washing their hands. He implemented a simple solution: hand washing with chlorinated lime. Deaths plummeted. Though his ideas were initially rejected, his work became a cornerstone of modern infection prevention. John Snow and the cholera map. Now meet John Snow, widely considered the father of modern epidemiology. In 1854, during a cholera outbreak in London, he used mapping to identify that most cases clustered near a public water pump on Broad Street. He recommended removing the pump handle, and the cases dropped dramatically. Snow's work discredited the bad air theory and showed how data visualization and observational research could stop an epidemic. Pasteur, Koch, and germ theory. In the late 1800s, science caught up with theory. Louis Pasteur demonstrated that microorganisms cause disease. He developed vaccines for rabies and anthrax and introduced the concept of pasteurization to kill bacteria in food and drink. Robert Koch took it further. He identified the bacteria that caused tuberculosis and cholera and used laboratory methods to confirm that specific microbes cause specific diseases. Together, they established the germ theory of disease, a major turning point in medical science. Florence Nightingale and data for health. Florence Nightingale is remembered not just as a nurse, but as a pioneering statistician. During the Crimean War, she used data and charts to show that more soldiers were dying from unsanitary hospital conditions than from battlefield injuries. Her work revolutionized hospital hygiene and helped shape early health system reform. Let's recap the key historic figures who shaped epidemiology. Hippocrates focused on natural causes of disease. Graunt introduced life tables and vital statistics. Lind ran the first controlled clinical trial. Jenner pioneered vaccination. Semmelweis introduced hand washing for infection control. Snow used mapping to stop cholera. Pasteur and Koch confirmed germ theory. Nightingale used data to reform healthcare, from history to modern practice. So why does all this history matter today? The insights and breakthroughs from these early pioneers directly influence how we manage public health now. Outbreak investigation is rooted in Snow's cholera mapping. Immunization programs trace back to Jenner's Kopok's discovery. Infection control practices are built on Semmelweis's hand-washing protocols. Data-driven decision-making owes a lot to Florence Nightingale's statistical reforms. Their legacy lives on every time we use contact tracing, monitor vaccine efficacy, enforce hand hygiene, or analyze public health data. Conclusion. We've seen how historical figures laid the foundation for everything from disease surveillance to evidence-based policy. Understanding where we came from helps us make smarter, more effective decisions for the future of public health. Thanks for watching. Be sure to subscribe and join us in Chapter 3, where we cover practical disease concepts in epidemiology. Each of these individuals contributed to the science and methods we use today in public health. Thanks for watching.